Good morning, guys. Let's go, guys. This is Amr from the Match Guy, a tutor with the Match Guy with 3 years experience in USMLE tutoring with too many success stories. Um, so I will be holding the live with you today, receiving your questions and telling you about USMLE, effective ways of USMLE preparation. So anyone having any questions, please type it in the chat. Okay, regarding preparation steps, starting with step one. Step one nowadays is pass or fail. Okay, you do not need too many resources. You just need one resource, stick to it, finish it uh, in 3 to 4 months. This resource is UWorld. UWorld gives you everything. UWorld gives you the baseline information required for you to pass step one. In addition, your word, this is a Q bank. It teaches you how the exam asks about each concept. So you need to master your word. That is enough. Your word, if you're using one resource, it will be your word. Okay. Um, what if you want to include another resource? Then I recommend using Anki. Anki helps you with memorization. For example, when you do your word questions, you get new concepts. You can take those concepts and make Anki card out of it, okay, to help you with memorization. So in this way, you covered everything. Anki plus your word, they give you enough information required to pass. Number two gives you the scenario. Number three, the memorization. And this is enough. And this takes us to the duration of preparation. Preparation duration depend on how dedicated you are, how many hours available for you daily. Okay, so your word is around, as I remember, your word step one is near 4,000 questions. Let's say you will do one block daily, 40 questions. So you will finish the Q bank in 100 days. 100 days. Let's say you will take 20 days weekend and rest of a study. So you will finish the first random in 4 months. After that, so after 4 months, you finished your word and you're going with Anki, you took enough rest and weekends, then you can take the first assessment. If you really studied well, you will pass the first assessment and you can take the exam. Okay. While if you did not pass the assessment, then you will reset you. Then depending on the assessment, if you have certain weak points, you can cover those weak points and take another assessment. If all the performance is bad, then you need to reset the word and start again. That is for step one. Ahmed is asking how to cover your word in the best way. Okay, in the first round of your word, I prefer going system-wise, system-wise to term mode. Okay, why system-wise? Because I want you to link the information related to the same chapter together. For example, in renal chapter, in nephrotic syndrome family. Nephrotic syndrome family is a big family with proteinuria, edema, losing fat in the urine, fatty casts, etc. That is the general picture of the family. Inside the family, there are subtypes. Subtypes. Each subtype has a specific key. So let's say minimally changed disease. I do this word question covering minimally changed disease. The second question, your word will give me another subtype. For example, membranous nephropathy. Okay. The third question will give me a third example, diabetes mellitus nephropathy. Okay. So I link and I compare questions together. So the first round, I prefer it to be system-wise and tutor mode. Okay. After the first round, in your second round, you can go random and timed. Why? In the second round, you already built foundation. You're in the second round, you're testing endurance. You're training yourself on exam style, time efficacy. Okay, how to answer under pressure. So the second round is more to be random and time. That is how you cover your work. That is point number one regarding the structure. Point number two, you need to take notes, but not copying your word. If you copy the explanation of your word, paste it in your notebook, you're creating a textbook that will not help you. Notes are taken from difficult questions that you got wrong, questions that you guessed, you answered correctly, but by guessing. Okay, questions that like were 50-50. You're not sure, like 50-50. So you take notes from that type of questions. And how to take notes? Short notes, not copying the whole explanation. No, short note. Short note, make it in Anki card, for example. That is the best way. Okay. And try to make the note interactive or active recall. Like, do not type, for example, NSAIDs can lead to peptic ulcer disease or kidney dysfunction, especially in old people. This is passive note. While active note is, why shouldn't we give NSAIDs for old people? And the answer, to avoid chronic kidney disease, higher risk of chronic kidney disease and peptic ulcer disease. So I told you about the structure of your word. I told you how to take notes from your word. Number three, I want you to revise your mistakes. The score improves with your mistakes, with targeting your weak points and mistakes. So every day you cover the mistakes of yesterday and you analyze those mistakes. My mistakes are they knowledge gap? Okay, I did not study well. Understanding gap. I do not understand the content. I have weak baseline. So I need like a tutor to help me. I need a video to help me understand the topic, or even ask AI to help me understand the topic. Or is it scenario problem? So analyze your mistakes. Analyze the mistakes, detect your problem, and fix it as early as possible. Okay, so this is the main 3 points that I advise with your work. Regarding how to use Anki, Ahmed, there are hundreds of YouTube videos telling you how to use Anki. Also, you can ask chatbots, AI to help you create those Anki cards and save your time. That is super easy. Regarding how many cards, I do not prefer doing too many cards. You know, it does not depend on number. It depends on efficacy. How effective are your cards? Like 20 effective cards can beat 100 non-effective cards. How is that? A card like the one I described a minute ago. Card like very short, covering one of your weak points in active recall method, like instead of listing NSAIDs potentiates the chronic kidney disease in older people. No. Why NSAIDs are contraindicated in older people? The answer: it potentiates or accelerates the renal failure, the kidney damage. So effective notes like that, at least do 20. And at least you need to cover most of your mistakes. So the number of cards will depend on the word mistakes that you had. Okay, so I do not recommend certain number, but do not make cards too long, just short concepts to the point. And do not do too many cards that overwhelm you. Too many cards, too many questions without absorption accelerates burnout and decreases efficacy. The answer to your question, Jaguar, spasticity and hyperreflexia, yes, you need to know about it. Super high yield, because in neuro, it tells you, is this lesion upper motor neuron or lower motor neuron? Okay, and this can help you exclude at least half of the choices. How? Defect in the brain or spinal cord, upper motor neuron lesion, spasticity, hypertonia, hyperreflexia. While peripheral nerves, lower motor neuron. That can help you with exclude many choices. So look in the choices, which disease affects the brain, which one affects the spinal cord, which one affects the peripheral nerves. Okay. Also, guys, I really recommend going on a plan. If you cannot make yourself a plan, that is not a problem. Find someone to help you set a plan. For example, I'm starting today. I'm an old graduate, for example. I did not study for long. I graduated 3 or 4 years ago. I cannot make a plan. I do not know what is the right resource. Find someone. Okay, find someone with experience. Find a tutor who can meet you for 1 hour planning. He can make the plan for yourself, and that can save you much time, much effort, and much money. Okay, so find someone to make you the plan. After making the plan will be your reference. For example, if I did not make any plans today, guys, I studied 40 questions, 40. Then I do not know if I did go, if I did well, or if I did bad. Okay, what is my reference? Are those 40 questions too much or too little? I do not know. I do not know because I do not have a reference. Okay. I do not know, should I be satisfied with myself and happy that I did 40, or should I blame myself that I didn't do 60? And schedule saves the time in too much thinking like that. Okay? So do a schedule. The schedule should evolve around your word because your word is fixed. Your word is fixed number of questions. Okay, you can start with 40 questions. That is the ideal thing, 40 questions per day in the first round, while in the second round, the timed one, at least 2 to 3 blocks. Okay, so this is the classic one. Okay, someone is asking how to take MBME the right way and how to work on the MBME after taking them. Okay, the first MBME you take at least when you finish most of the word content. When you finish most of the word content, okay, after the first round, then you take your first assessment. Then look at the report. Do not focus on the result. Result does not matter or is not as important as the report or the analysis. The analysis of MBME is what matters. It can tell you about your problem. Generally, do you have certain gaps, certain weak points? Like you have problem in cardiology chapter. You answered all cardiology questions wrong. Okay, then you can revise cardiology. Or you have a problem generally in physiology of all chapters. Then you can cover physiology. Okay, so the school report uh, matters more than the result. This is how you analyze MBME. Then make a new plan according to the MBME analysis. After you finish that plan, take a new assessment to see about your progress. Are those weak points covered or not? Is physiology mastered till now, or my plan failed? Okay. Someone is asking about AMBOSS, when to use AMBOSS and AMBOSS against your word. Okay, guys, AMBOSS is different from your word. Your word is our cornerstone. Your word is our cornerstone. This is where we get our knowledge, where we train on exam style, okay, where we take notes, while AMBOSS, guys, is only for two people, or I can say one, only one. People with weak points that could not be covered by your word. Then I can go to AMBOSS. The most common weak point in USMLE, ethics and biostats. And this is the most common purpose for which most students use AMBOSS, to cover ethics and biostats. So, and this is my advice. You do not need to do AMBOSS plus your word. No, 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 no. One Q bank is enough. Either for step one and step two. One Q bank is enough, which is your word. AMBOSS can give additional support for certain weak points. Okay? Like biostats, I need to do more equations in biostats, more ethics and quality scenarios, more screening and vaccination scenarios. Then I can use AMBOSS for this little purpose. Okay. Someone is asking about CMS forms for step 2CK. High yield, super high yield. Okay. Why? CMS forms are created by MBME organization. That's why they are super high yield. Number two, they are similar to exam style. They are made by MBME. So of course they are similar to exam style in length, in target, in organization. So they are more similar to exam style than your word. So of course you need to cover CMS forms. But you know, I have an opinion regarding CMS files. My style and my advice to step two students is like this. When you cover your word, when you finish your word, take your first assessment. Okay? As long as you finished your word, along with the notes, along with revising the wrong points, day by day. Okay? So now I finished your word, I memorized everything, I covered my weak points day by day by Anki, for example. Then take the first assessment. The first assessment will show you, will expose some weak points. Will expose some weak points. Okay? Those weak points can be covered by CMS. For example, one of my students, after the first assessment, had a problem in emergency and surgery sections of each chapter. So that is the weak point, generally emergency and surgery chapter. So the next approach is clear. We will cover surgery and CMS. We will not do your word again. We did it once. So we will go to CMS forms, the surgery and the emergency section. After this is good. Okay, let's take another assessment. The new assessment told us that the lowest percentile is with pediatrics or is with neurology. Then let's cover CMS forms of neurology. Clear? Okay. But my advice for everyone who want a very high step to score, yes, do all new CMS forms. One important point regarding MBME, guys, and it is more important than MBME result, it is the trend. Look at your assessments. Are your assessments increasing, flat, decreasing? That's what matters more than the result itself. So the initial result, no problem in it. For example, me and we finish your work together. My friend initial MBME assessment is for step 2, for example, 220. No. My friend assessment is 250, while my assessment is only 220. Do not be sad. I will not compare myself with my friend. He might be smarter than me. He might had more free time than me. Okay, more capabilities than me. No problem. I will not compare myself with others. I will compare myself with my old self, my new MBME with the old MBME. So the 220 MBME, I will work on what my weak points. After I cover them, I will take another. The next MBME showed 230. That is good. I progressed 10 points. I will keep working on weak points. I became 240. So what matters is the trend. Do not be sad when your first MBME was not very well, was not what you thought about. No problem. The trend matters. As long as you're progressing, even if that progress is slow, that is a good sign. And that is the sign that tells you you are doing good. You are progressing good. Jaguar, we prefer questions to be about preparation. But do not worry, every week, guys, we will hold a live answering about most common problems with USMLE. Now we will talk about preparation. If you want specific topic to be covered in the upcoming lives, type it in the chat or text us, and we will arrange that. So we covered step 1 resources. For step 2 resources, your word is your main resource. After you finish it, you take self-assess. Of course, along with Anki, as I told you, Anki will help you with the notes you missed. Memorize the notes you missed. Take assessment, The weak points, you cover it by CMS forms. That is enough for step 2. So till now, guys, we covered the questions, step 1 preparation, step 1 resources, step 2 resources, the duration of preparation, Anki, how to use it, difference between UWorld and Ambos, how to use CMS forms, talking about MBME, when to take MBME, how to analyze MBME. Okay, so 7 questions till now. A very important point, guys, that I need to tell you about is how to solve a question, a USMLE question. When you go to the question, guys, go to the last line. Read the last line first. Why? To know about the question direction. Okay? To know what the question want from you. Like, does the question want diagnosis, next step, management? So now I know the question. Then read the choices rapidly. Skim through the choices rapidly, because the choices will tell you where are you located, what is that chapter or what is that topic. If you find the choices giving you things like post-streptococcal glomerulonephritis, IgA nephropathy, Alport syndrome. So the question is in renal chapter. Okay. For example, what is the diagnosis? This is the diagnosis chapter. In which section? Nephropathy section, especially glomerulonephritis, differential diagnosis. So this tells me where am I at? That is number 1. Number 2, go back and read the whole question. When you read the whole question, focus on the pivot sentence, the sentence that changes everything. For example, when they mention something like acute change, acute drop in blood pressure, acute sudden pain, or progressive or sudden, or the symptoms after starting a drug. Okay, after starting this drug, the patient felt numbness or the patient felt muscle weakness. All right, so spot red flags or spot things like that. Also, vitals, skim through vitals rapidly. Is there any instability? Is there any response to treatment? Okay, all right, and ignore the noise. Ignore the noise like very long history that is made to distract you. All right. Then after that, stop and summarize. Summarize the question in 1 sentence. Clear, guys? So this is the exact approach of the question. First, you read the last line to know what is the question purpose, diagnosis, next step, treatment, or complication. Then read the questions the choices very rapidly to know which topic is that, all right? Which chapter is that? Which section is that? Then look for the sentence that give you acute changes or red flags like vitals, timing, acute, progressive, after a drug. All right. Then summarize that in 1 sentence. This is how you target the question super effectively. Another tip, guys, on how to another tip on how to exclude the choices that will really increase your efficacy. How to exclude choices, guys? First, know the question type: diagnosis question, next step question, management question, complication question. So what is the purpose of the question? Number 2, Kill or exclude options with wrong time. With wrong time, like what? Too early, too late. For example, acute chest pain, ECG shows ST segment elevation, cardiac enzymes are high, myocardial infarction. Okay? They will list two choices: thrombolysis, thrombolytics, alteplase, or PCI for coronary continuous intervention. Thrombolytics are generally safe. One of the steps is so thrombolytics are general, are correct in general. Okay, but it is too late. If PCI is available, PCI is first line. So kill options with the wrong time, like the too early options or the too late options. Number two, check the patient fit. How is that? Like the patient age. Look at the choices. Does this choice correlate with the patient age? For example, Huntington disease, guys, and multiple myeloma mostly present after 40 years. So if they give you a patient with 20 years, go to the choices and exclude multiple myeloma, exclude Huntington disease, right? So check patient fit, like age, like pregnancy. This disease is not related to pregnancy. Vitals, for example, a choice, a disease that in which the patient should be hypotensive, while the initial question, no, the patient is stable. Comorbidities, so check patient fit. The third tip to exclude choices: use physiology. Any choice that contradicts basic physiology, eliminate it. Okay? Like, those symptoms cannot be explained by this. A disease like this cannot explain the symptom. Exclude. All right? For example, for example, um, potassium abnormalities, guys, either hyperkalemia or hypokalemia, gives you this mix: muscle weakness plus arrhythmia. Muscle weakness plus arrhythmia. So if you see in the choices a disorder affecting the muscle, giving muscle weakness, like statin, using statin, for example, okay, or polymyositis, that is not related to arrhythmia. So that does not explain the physiology. So I will exclude a choice like that. Another tip: look for extremes. Extreme sentences like always, never, immediate surgery. Generally, most questions in USMLE, the extreme answers are wrong. USMLE loves simple answer. Okay? So those are the 4 tips that can make you exclude questions correctly. I want to tell you a very important point. Sometimes, guys, during your preparation, during the whole period, one habit can change everything. Just one habit. If you ask me about, like, give me one habit that can change my preparation 100% degree, I will tell you: review mistakes, daily review of your mistakes. That can save much time and effort. Much time and effort. Every day, do your word questions and revise the previous ones. In addition to revising the mistakes of yesterday, analyze those mistakes. That is more importantly. Analyze those mistakes. Discover your weaknesses. Do you have problem with understanding? So I will use ChatGPT to help me understand. I will buy a course, video course to help me understand, or what? Is it scenario problem? I do not know how each concept is asked. I know the concept, but I do not know how it is asked. Then I might do too many questions. I might hire a tutor to help me with scenarios. Okay, so if you ask me what is the habit that can change my preparation 100%, is daily review of your mistakes. Daily review of your mistakes. If you ask me what is the number two trick or habit that can help me, is before you start, set a schedule. If you cannot make a schedule, if you cannot make a plan, no problem. Seek help. Ask someone to make you the plan. Ask someone like experienced friend who passed the exams, like a tutor. Meet a tutor for 1 hour to help you make a plan. All right, that can save much time in your preparation and much effort. Another important point, a very common problem, guys, I see with the students booking sessions with me. Doctor, I know the question, I know the concept, but I answered the question wrong. How is that? How can I get this question wrong? I know the concept. Here is the answer. There is a difference between recognizing a concept and knowing a concept. Okay? Recognizing a concept, you see the concept, it feels familiar, you think you know it, but you need options to help you. This is weak knowledge. While knowing a concept, I predict the concept before the traces. I can explain to others why it is wrong. I answer it fast. Okay? So USMLE rewards knowing the concept, rewards the recall, not the recognition. Okay, so how to convert recognition into knowing? Active recalls. Active recalls by questions. Active recalls by Anki. Active recalls by trying to explain that concept to others. Teaching the concept to others. That can convert it from just recognizing the concept into knowing and mastering the concept. And that, guys, what differentiates between someone. You might read USMLE success stories in social media, and you see someone prepared step two in 4 months, for example, and got a high score. How is that? I'm stuck in months in preparation. So because of daily habits like the one I shared with you. So if I want to summarize what we discussed till now, guys, I told you about resources for step one preparation. Hmm. Step one preparation, step one resources, step two preparation, step two resources, the mistakes, the common mistakes that students do, difference between your word and amboss, okay? Uh, Daily habits that can increase your efficacy and raise your score, the importance of revising your mistakes, the importance of using Anki, analyzing your mistakes, the importance of setting a good plan, All right. So I think this is what you need regarding USMLE preparation. If you have any more questions, guys, and if you need more topics that we can cover for you, text us and we arrange weekly live meetings. All right, guys. I will see you next week.